Where should the shoulder hurt if you have a rotator cuff injury? There's 3 spots that consistently hurt, at least one of the 3, if you have a true rotator cuff tear or just an irritated rotator cuff tendon. Those rotator cuff tendons, they live on the shoulder blade. You can see it better. I'll do this side on the back of the shoulder blade here, and there's one on the front of the shoulder blade too, one on the top. They all send tendons out to the ball to pull the ball into the socket. And so the tendons all live right here on the top of the shoulder. This is called the acromion. On yourself, it would be the corner of your shoulder. So if you just fall off your corner of your shoulder, the acromion, you're on rotator cuff tendons. And the most common tendon torn is right here at the top of the shoulder. The other places you can feel pain, tenderness, is on the back right here. Just move your finger over a little bit. I'll show you myself in a second. And then on the front, move your finger over to the front. So the way that you would feel yourself here is there's the corner of my shoulder. I feel the bone right here on the top. I'm just going to fall off the bone. The top is right there, and then the front is right here. It's the front of the ball and socket joint. And then the back is, here's the corner of the shoulder right there. So if any of those spots are tender, you'll have to compare to your other side. If it's tender there, if it's not tender on one side, but it's tender on the other side, and that's the side that you're having problems on, then that's very consistent with having an injury to your rotator cuff tear. Now, this is a measure that I use with my patients in the clinic that have not had MRIs before, that have not had an ultrasound, that have detected a torn rotator cuff tendon. I'll poke in there and then correlate that with the limitations in being able to reach up overhead, being able to reach behind their back, any sort of injuries they've had in the past, and just kind of getting the history together. And that's how we can decide that there's likely a rotator cuff tear here without knowing from an MRI or an ultrasound. But there's other symptoms as well that you may have that can just kind of seal the deal on you having a rotator cuff tear. However, these other symptoms can happen independently from having a rotator cuff tear. And the reason is because they all have the same root problem, which I'll talk more about in just a second. There's 4 other symptoms that you're looking for. One is neck pain at the top, especially when turning your head. And it doesn't matter the direction. Sometimes it's towards the side that hurts or away from the side that hurts. But if you have the sensation where you turn and it kind of just hurts your neck, that's associated with the root problem that can cause a rotator cuff tear. Now, this may come and go. You might wake up with a locked neck where you can't turn one way because you're stuck, but you can turn the other way just fine. That I would count that as well if you have a history of having neck symptoms. The next symptom is pain that's kind of between the neck and the shoulder in this region. On your body, it would be like right above your collarbone, right in here. Not really the trap muscle up here, but in front of the trap muscle between that and the collarbone. If you have pain in that area, there's some muscles that live in there and some important nerves that go down into your arm. If you just poke the area and it's kind of tender and painful, maybe one spot in particular that's really tender, and then you do that on the other side and it's not as bad, then that's consistent with having some muscle imbalances that are causing those neck muscles to work extra and possibly irritate the nerve that's in the area that goes down into your arm. The next symptom is related to those same nerves. There's a nerve in particular that runs through the back of the ball here, and it runs down the shaft of the bone and down into the rest of your hand. But right here, mid-shaft, on the outside of your arm, right about here, sometimes a bit higher, it's called the radial nerve. That nerve can become irritated and it'll cause some pain, some dull, achy pain right in this area. And it tends to get worse with the more activity that you do. That's also consistent with a rotator cuff tear. What a lot of people think, even medical professionals, I see this all the time, they think that that's your rotator cuff right there. They think that it comes down to this area, but that's not the case. It's actually the radial nerve that's irritated from your neck and right here above the collarbone. Of course, the issue going on in the shoulder, but then you have irritation from the nerve right in this area. Then down the pathway of those same nerves into your hand and fingertips is the next symptom. People get numbness and tingling, sometimes pain as well, into their hand that's involved with the rotator cuff tear side. That's worse compared to the other side. If you're holding up a phone to look at your phone or to hold it up to your ear, or sometimes when sleeping at night, if you have your arm at this position, the numbness, tingling, and sometimes pain can be worse in the side that you have a potential rotator cuff tear. Now, all 4 of those symptoms, the neck pain up here, the tenderness above the collarbone, the pain on the side of the arm from that radial nerve, and the numbness and tingling in your hand, can happen independently of there being an actual rotator cuff tear because of the root problem, which is a muscle imbalance that affects the way that the rotator cuff moves, the way the neck is stabilized, the way the shoulder blade moves. The way that all those things move together needs to be considered so that you can solve the root problem and protect your shoulder, the nerves, the rotator cuff tear, everything, so that you can have long-term improvement and not worry about re-injuring things. That main problem is it tends to come from a muscle called the upper trap up here. It's not as strong as it should be in all these cases. That's why it starts with neck problems up here that pinch nerves, and it runs down into the shoulder blade, the rotator cuff tendons, and all the way into the hand through the nerves. If you can get stronger in that upper trap muscles, there's several exercises you can do. You just have to make sure you're doing them the right way and progressing it properly. Then you can usually solve the root problem and protect yourself from having a surgery. I've got tons of videos to help you with this, especially if you have a rotator cuff tear. I've got a link in the description below for a playlist called the Rotator Cuff Tear Help Playlist. It's all our videos that have advice, tips, and exercises on helping heal a rotator cuff tear naturally without surgery. You can find that in the description below. And I've also got a program called the Rotator Cuff Tear Recovery Program that's a detailed step-by-step program on how to heal a rotator cuff tear naturally at home. You'll find more information through the link in the description for that down below too. Hey, thanks so much for watching this video. Give us a thumbs up if you thought this was helpful. Please subscribe and hit the notification bell if you haven't already so that you don't miss out on any of the videos we post each and every week. And please share this with somebody that you think would benefit from seeing this. Thanks so much for watching. I'll see you in the next video. Bye-bye.